Parliament today set to finally vote on the controversial National Health Insurance Bill after a week's postponement. The bill aims to offer universal coverage for all South Africans with one pool of funding for private and public healthcare providers. It was passed back in July by the National Assembly. Now, if adopted at the level of the National Council of Provinces, this bill will be sent to President Cyril Ramaphosa to be signed into law. Now, to help us unpack the importance of today's vote, I'm joined by health activist Dr Kgosi Letlape, a very well-known activist in the healthcare space. Dr. Letlape, thank you very much for your time. A very important day indeed it is going to be for the country today, but I'd like us to humanize this bill. But before we get there, Doc, how important is this particular vote at the National Council of Provinces, given the amount of criticism that has been targeted at this bill?
I think it is important to have a bill. To start with, good morning to you and to the viewers. It is important to have this bill tabled because it is essential that we create a unitary health system for South Africans, where those with means cross-subsidize those without means. And the major problem is that we have a bill that does not really go far enough in terms of what needs to be fixed. It also doesn't give assurances about tackling the challenges that we have right now. The biggest problem that we have in our health system is wastage, both publicly and privately.
Yeah.
And there's nothing in the bill that begins to tell us how those issues are going to be challenged. The concept of one fund for all of us is a concept that is admirable. But we need to ensure that we have a system that works.
You're saying, Doc, that it doesn't go far enough. And I did say at the beginning, I want us to try and humanize it. You know, just before coming to you, we were in Soweto. Our reporter is out looking at young people who are addicted to substance abuse, nyaupe, to be particular. And the images that she was beaming to us, Dr. Letlape, it can make you cry because you can just tell that these people, this drug that they are on has literally snuffed out the life out of them. How would a bill like this address a challenge like that one? Because those people, you don't have to guess that they don't have money to take themselves to rehabilitation centers. And so that's where the state will probably have to come in.
You know, it's very difficult to talk about those issues from inside the bill. What we need to look at is currently what we have, both publicly and privately. People that are addicted to substances have challenges getting access to care. Addiction services are not adequate for the size of the problem that we have in our society. There aren't many addiction centers or cessation clinics, both publicly and privately. There were efforts under a previous mayor in Johannesburg to create more addiction centers. So the challenge there is about prevention so that we have youth in education that leads to employment, a society that is not stressful to its citizens. So we got to look not just at issues of how we help those with substance abuse problems and addiction problems, but how we create an environment where less people will resort to drugs for relief. So we have challenges that are socially engineered, but we have a health system that is inadequately resourced to deal with mental health issues and addiction problems. And that is a situation both publicly and privately.
Dr. Letlape, you're very clear in your assessment that this is a very good bill, but there are deficiencies. Talk to us about whether you agree. Talk to us about whether you agree with the private healthcare sector who have been very vocal about how this bill is destructive and if allowed to proceed in its current form, it will absolutely destroy the healthcare sector. Is that criticism coming from a good place, or do you think that there are financial interests that are going to trump what the bill seeks to do, and that is to provide universal healthcare?
I think what I must be clear about is that it's good intention in terms of what is intended. But there are flaws in the bill. Because part of the thing that we have is challenges of wastage, which occurs both publicly and privately. But remember, where there's wastage, there are beneficiaries. If you look at the wastage in the public healthcare system, it's because of our procurement system, the tender process, where we have tenderpreneurs and we're not getting value for money. When you look at the private system, you have administrators that add absolutely no value but are taking out a huge chunk of money. Benefit packages are poorly designed, both publicly, particularly in the private sector. So the private sector is going to protect what it has because we have this perception that what you have in private is better than what you have in public. And you have commitment to separateness that business will take to the courts so that privileged South Africans should be sheltered in what we call a private healthcare system, which is basically privatized. But what they recognize is the fact that the success of the private sector is dependent on continuance of the current medical schemes that we have. Any attempts to reform and make medical schemes work for its members is going to be damaging to business interests. And that's why it is going to be opposed. So what we need is a clear plan that articulates those issues, that takes away fear from citizens, that we're not going to destroy what you have. We're going to give you security in what you have.
Yeah.
And what should have been considered, Xoli, is, for example, to do simultaneous reforms in both public and private. In private, we should be assured of implementing some of the market inquiry recommendations. For example, universal health package, tariff negotiation, so that there are negotiated fees for service providers, but the security for members of medical aid in terms of the care that they're going to get. If I ask you, if you're on medical aid, you don't really know what you covered for. You think you covered until you get sick, and then you discover that you have no cover.
Yeah.
If you go to a public institution, you're not too sure of the type of care that you're going to get. Now, what needs to happen is that parliamentarians have to lead by example. As they nationalize, they should be nationalizing the parliament medical aid first and saying all other South Africans can come and join us. That's how we pool funds. What is concerning is the fact that what parliamentarians have as power made is largely left intact, with issues of intent that when we've got an NHI, you don't need to have a medical aid. Those are dangerous instances. What we do not want, Xoli, is to end up in a situation where those that are not on medical aid are forced to come into a national fund that is controlled by the people that are currently can't deliver public healthcare services. Where we have monies that disappear, where we had the challenges that we had with procurement around COVID. We need assurances about a dependable procurement system devoid of corruption, about abolition of waste, both publicly and privately.
Yeah.
And that we are building a system that all of us will use with common entry points and a common benefit structure for all South Africans. None of those issues are seen with clarity in what is being proposed right now.
Professor Letlape, you have managed to sum up what is a massive document, but you've summed it up in a way that we can understand what the deficiencies are. So let me ask you one final question, and very briefly, if you can, given what you have pointed out to be these deficiencies, is it wise, will it be wise for the NCOP to put a rubber stamp this afternoon on this bill so that President Cyril Ramaphosa simply puts a signature at the end of it all without the fixes that you are pointing to?
Firstly, thanks for the professorship, but I'm not a professor, I'm just an ordinary doctor. Secondly, my plea would be that this is an opportunity to bring South Africans together. Let us not be hasty to come up with a bill that's going to divide us further. If I was the president, if I was the NCOP, I would say every South African needs to be listened to. We are not going to pass a bill where there is so much controversy, where the bill is just going to further divide us and just make lawyers rich, and we spend time in the courts instead of time in the clinics fixing our healthcare system. And I would urge the authorities to say, let's create better dialogue so all of us have security. But we also need to have courage where we are overhauling the healthcare system and financing from beginning to end in a bill that answers all questions, where we assure South Africans that there will be no wastage, there will be no corruption, there will be no losses to the health rent to people that have no business and add no value to healthcare services to our people.
Healthcare activist Dr. Kgosi Letlape, thank you very much for allowing us to interrupt your itinerary, talking to us from Singapore there. He is on business. Thanks indeed for your time, sir. All right.